Welcome to the 8th video in a series providing analysis of the COVID-19 virus spread throughout the regions of the world. This view from the World Health Organization represents cases reported in the last 7 days from countries and territories. It's shaded 1 through to 100, 101 to 1000, 1001 to 10,000, 10,001 to 50,000 and over 50,000. Significant contributors are United States, Brazil, Spain, United Kingdom, France, Germany, Turkey, Iran and Russia. Daily I've been conducting analysis and the data generated from the World Health Organization and the Johns Hopkins University live database. It's not unusual to find data discrepancies between national sources and those collated by the World Health Organization and the Johns Hopkins University. However, we are able to provide a trend over time. This view provides data from China. China currently has 83,369 COVID-19 cases. That's an increase of 494 from last week. China reports 3,349 deaths attributed to COVID-19. That's an increase of 14 in the last 7 days. China continues to relax the restrictions within its borders, especially around Wuhan. There is continued disbelief in the Chinese COVID-19 data from around the world, and as the full health crisis and economic crisis develop in other countries, China and the World Health Organization have been heavily criticised by their actions or inactions during the first few weeks of the outbreak. This view shows the data from the Western Pacific region excluding China. In the Western Pacific region, there has been 34,970 COVID cases. That's an increase of 7,093 in the last 7 days. There have also been reported 662 deaths attributed to COVID-19. That's an increase of 177. Both Japan and Singapore recently implemented stricter controls in their countries. South Korea, Australia and New Zealand are seeing the benefits of the controls implemented with very little evidence of community transfer. The next several views will discuss the data from Europe. Europe reported 839,257 cases of COVID-19. That's an increase of 200,338 cases. Deaths attributed to COVID-19 stand at 70,565, an increase of 24,447. The majority of COVID-19 cases come from the 5 major economies in Europe: Spain, Italy, France, Germany and the United Kingdom. They're closely followed by Turkey. They all have a mortality rate at or exceeding 10% of cases, except Germany, which has a mortality rate of just over 2%. The question from the other European countries is, what is Germany doing differently to them? A number of European minor economies have indicated that they will shortly relax the restrictions placed on their populations and economy, and this is discussed later. This view provides data on the Southeast Asia region. This region reported 14,161 cases of COVID-19. That's an increase of 6,346 cases in the last 7 days. They also reported 617 deaths from COVID-19. That's an increase of 320 in the last 7 days. The main contributors in this region is India and Indonesia. India is the second most populous nation in the world, whilst Indonesia has the largest Muslim population in the world. The governments of both countries may be having difficulties in obtaining accurate, reliable numbers to report. There is evidence of widespread infection rates and morbidity rates in both countries, not reflected in the data from the World Health Organization and Johns Hopkins University. This view reports on the data from the Eastern Mediterranean region. There is 92,226 reported cases of COVID-19. That's an increase of 26,323 in the last 7 days. There is 4,771 deaths attributed to COVID-19. That's an increase of 1,179 in the last 7 days. Iran continues to contribute the majority of cases, followed by Pakistan and Saudi Arabia. The data coming out of Iran should be treated with a high level of suspicion. This view reports on data from North and South America, excluding the United States, which is in the next view. This region reported 75,389 COVID-19 cases, an increase of 22,844 in the last 7 days. There has been 2,698 deaths attributed to COVID-19, an increase of 1,522 in the last 7 days. The main contributors in this region is Canada and Brazil, excluding the United States. This view reports on the data coming out of the United States. The United States now has 461,275 cases of COVID-19. That's an increase of 149,974 in the last 7 days. They've reported 16,596 deaths attributed to COVID-19. That's an increase of 8,120. One startling stat coming out of the US this week is the high mortality rate within ethnic groups, i.e. African Americans, which is disproportionate to white Caucasians. African Americans are known to have an increased level of underlying health conditions, obesity, cardio, respiratory and diabetes, but more studies are required to ascertain the vulnerability of this group. That aside, the transmission rates across the whole of the United States indicate, as with other major economies, a widespread lack of preparedness, and no amount of finger-pointing at other countries can hide the fact they didn't prepare. This view shows the data from the African region. This region reports 9,340 cases of COVID-19, an increase of 3,894 in the last 7 days. There has been 415 deaths attributed to COVID-19. That's an increase of 245 in the last 7 days. The majority contributor in this region continues to be South Africa and Algeria. However, there is major concern for this region due to the condition of the health systems in each country. The next few views will provide analysis of the major economies of the world. The data continues to indicate that out of the G7 countries, the United States is in for a tough time to come with high levels of transmission and mortality compared to their other countries. All other major economies in Europe are not yet at the stage of considering relaxing control to prevent further spread. A number of countries have managed their health emergency very well. Australia has a relatively low transmission rate and low mortality rate. Japan, Singapore and South Korea also have low mortality rate. Other countries need to be also looking at the German data. It has one of the highest infection rates in the world, but one of the best recovery and mortality rates compared to the other Western societies. In this next view, we will discuss when will it end, when to relax either fully or partially the restrictions placed on populations and economies. This is not just a global health emergency, it's also a global economic emergency. This is a difficult dilemma facing all governments around the world. Almost all countries have implemented social and physical distancing as the primary method of slowing the spread of the virus and restricting gatherings to between 5 and 10 people, depending on the circumstances. This is done to flatten the curve. Without flattening the curve, the health system would be overwhelmed and collapse. Individuals who require access to critical care and mechanical ventilation would be denied, resulting in widespread increase in mortality rates, especially in the vulnerable and elderly. But this comes at a cost to the economy. Governments will come under increasing pressure to relax restrictions to allow their economies to restart. Restart too early and we have a boomerang effect, and COVID-19 cases once again increase and the governments have to again shut down the economy. Governments will be modelling depending on the situation within their countries. They will also be analysing closely those countries that attempt to relax restrictions and restart elements of their economies. There is no magic bullet with this virus. Scientists are still analysing this virus and have yet no medical cure as yet. In video 7, I discuss herd immunity. The only solution is a vaccine. In this view, we look at 4 countries that have indicated they are preparing to restart their economies and relax restrictions on their populations. Austria, Denmark, Czech Republic, Sweden and Norway have all indicated that they will end some restrictions to restart their economies. The graphs on each country indicate that largely they have been successful in flattening the curve, but there is still early and therefore there remains a significant risk to their populations and economy if they go too early. China is finding that the majority of cases are now imported. A potential solution is to aggressively test in the community. Once cases are identified and quarantined, the authorities need to aggressively carry out contact tracing and then self-isolation. The World Health Organization recently published data from Italy that identified 51,314 cases of COVID-19 in healthcare workers. That represents 11% of infections in Italy at that time. While many infections are mild, severe outcomes, including death among healthcare workers, have also been reported on a daily basis. A priority in the clinical setting, whether that's in a hospital, a clinic or a care home, is infectious control. It's ensuring our healthcare workers have the tools to ensure they can conduct their work in a risk-reduced environment. It's ensuring that they understand the importance of maintaining barriers and provided with adequate barriers and training. Clinicians must have a high level of suspicion when a patient arrives with a high fever and respiratory symptoms until an alternative diagnosis is proven. There has been multiple cases of late recognition or suspicion of COVID-19 virus. All healthcare workers need training for respiratory pathogens, especially COVID-19. All healthcare workers need training on how to don and disrobe PPE without self-infecting themselves. There is a wealth of misinformation on COVID-19 circulating the internet and social media. These include cures. There is no cure at present for COVID-19. A vaccine is months away. Another ridiculous claim is gargling with hot water. It doesn't work. The local environment, i.e. the sun, the cold, have not been proven to be an effective barrier. Please do not spread, either on social media or the internet, obvious false claims. Your national government, states, governments will have the latest safe and reliable advice on COVID-19, or you can go to the World Health Organization website. Finally, remember to socially check in with your family and friends. Use any of the smart apps on your phone. Do not assume everything is fine because you haven't heard from them. Do welfare checks on work colleagues. That's good leadership. The elderly are not as skilled with modern technology than you. Conference calling can be set up, but be patient and innovative in your problem solving. Please don't book a cruise on a floating incubator. Feel free to drop me a note via email, YouTube, LinkedIn, Facebook, and my email address is below. Thank you.